All right, hi everybody, I'm Nolan Hoffman. Thanks for joining us here tonight for East Texas in Focus. Let's get started with our topic. So tonight we're focusing on the new SNAP restrictions here in the Lone Star State, as beginning April 1st, Texas implementing new restrictions on its Supplemental Nutrition Assistance Program, or commonly known as SNAP. Changes that are already sparking some debate across our state. Supporters say these measures are designed to promote healthier food choices, reduce misuse, and ensure taxpayer dollars are spent more responsibly. But critics warn the rules could make it much harder for low-income families to access the food they need, especially in communities already facing limited grocery options. Today, we're taking a closer look at what's changing, why these restrictions were introduced, and the real-world impact they could have on millions of Texans who rely on SNAP to put food on their tables. We begin this episode with Nabil Rahmani, who tells us what these changes are going to look like across the state.
I'm Nabil Rahmani in Austin, Texas, and there are some big changes for the SNAP benefits program here in the state. That means no more candy bars and no more sugary drinks. No candy?
It's candy bars, hard candy, lollipops, gum.
Or sodas. Texans in the Supplemental Nutrition Assistance Program, or SNAP, won't have those items covered any longer.
We know there'll be a learning curve.
Celia Cole is the CEO of Feeding Texas. Her job is to make sure Texans are getting the food they need. And now she's also helping to educate SNAP recipients about the latest changes.
It's definitely, I think, a component of the Make America Healthy Again initiative or movement. I think the intention is to reduce consumption of products that, when you consume them in excess, can be bad for health. And so I think that's obviously a worthy goal.
SNAP is federally funded, but it is operated and managed by state agencies. Governor Abbott joined several other state leaders in the push to remove candy and sugary drinks from SNAP benefits. He said this is to ensure taxpayer dollars are used for food with nutritional value. U.S. Secretary of Agriculture Brooke Rollins recently spoke about the changes.
So when I got here and I looked around and said, why in the world are all 50 states allowing junk food and sodas to be purchased with taxpayer dollars on the front end, and then the back end, the health issues?
She says more states are looking to make the move.
We've got more waivers coming in, hopefully another dozen or so very soon, but we've already approved 20. And yeah, so in those 20 states, you cannot use taxpayer-funded food stamps to purchase junk food and soda.
And here in the state of Texas, there are about 3.5 million people who rely on SNAP benefits. In Austin, Nabil Rahmani, back to you.
We're also going to hear more from the Agriculture Secretary later on in the show tonight. I also had the opportunity to speak with Cecilia Cole, the CEO of Feeding Texas, for an in-depth conversation about what exactly is included in these restrictions and why the organization worries about the effects they will have on families across the state.
I want to just talk about the SNAP program here in the state of Texas and what it does for families every month.
Yeah, SNAP is the most important nutrition program that we have in this country. It reaches about 3.5 million Texans. A majority are older adults, children, and people with disabilities, but it serves working families, it serves veterans. It's a really broad-based program. And most people have earnings at or near the poverty level. Most able-bodied adults are working, but simply not earning enough to put food on the table and pay for everything else. And it basically provides a grocery benefit. People get a certain amount of dollars per month on a debit card called the Lone Star card, and how much they get is based on their household size and their income and other expenses. So it's a very critical program to help people who aren't earning enough to make ends meet, ensure they have access to good nutrition.
Absolutely. So with these massive I would call them pretty massive shakeups in what people can now get and what they cannot get. What are the biggest things people have to know right now? Again, who's going to see this interview? What's
Sure. So if you're a family participating in SNAP and you go to the grocery store, you got to look out for a couple of things. So if you're buying juice or other types of beverages besides water, look for how many grams of sugar. So anything with 5 grams of sugar or more is now prohibited. So you can buy it, but you have to use your own money. You can't use your SNAP benefits. You can still get milk, chocolate milk, anything with yogurt, anything that has milk in it. it is sort of excluded from the sweetened beverage restrictions. And then the other big item is candy, and that includes candy bars, hard candy, gum, etc. So again, people should avoid those if they don't have their own dollars to purchase them, because they can no longer be bought with SNAP benefits. A couple of things that people should know: electrolyte grade or medical grade electrolyte drinks like Pedialyte are still allowed, but things like Gatorade and other sports drinks are not. So those are sort of the big things to remember. And then I think the other thing that's super important to know is that if it's up to the retailers to program their systems to put these restrictions in place. So if somebody on SNAP goes in and buys a candy bar and uses their SNAP benefits because the retailer hasn't programmed their system, they're not gonna be penalized. That's on the retailer.
Totally. That's actually what I was going to bring up next. That wasn't one of my questions here, but that makes a lot of sense. Is there a specific group of people in Texas here, maybe income-wise, that are going to be the most affected by this that you can talk about? Because obviously, if you don't have a lot of money, maybe you're going to go to some of those highly processed foods, because it's just what you have to do to survive and get food on the table.
Yeah, I mean, it's important to keep in mind SNAP serves these restrictions are going to affect anyone getting SNAP. So regardless of, your demographic or where you live, or any specific dietary needs you might have, you're going to be subject to these restrictions. They apply to everyone on SNAP. And that does, I think, raise one of the questions about, are we going to be restricting items for certain populations that may actually benefit from those items? So in other states, it's come up that if someone is diabetic, they may need candy. But again, you can buy those things with your own resources. And I think it's important to remember too that these are although they're broad categories, the restrictions are very specific. It's about candy and it's about sweetened beverages. So if people want to buy granola bars, other processed foods, those aren't being restricted at the moment. It's just those really high sugary content foods that these restrictions are sort of in place for, to sort of test whether that leads to reduced consumption.
Yeah, I was going to bring up, somebody brought that up to one of my coworkers about the diabetes aspect of this. Again, if somebody who gets, certain candies to help with their blood sugar, I don't know if you can speak on it, but where should they turn now? I'm sure there is healthier options out there to help them, where they're not getting, Hershey bars and stuff like that, where a lot of people would get that too, just spike that blood sugar or help that.
Yeah, I mean, it's a good question. So again, the restrictions apply to everyone, so they don't make exceptions for people with specific, nutrition-related health needs or diet-related diseases, or even something like diabetes that may not be diet-related. So if a person needs to buy candy because of that, then they would have to use their own resources for it.
All right, that's a good start. Tonight, when we come back with East Texas in Focus, much more with Feeding Texas and its CEO, and more in depth with our topic. We'll be right back. Welcome back here tonight as we continue to turn back to the new SNAP restrictions now in effect across Texas. The changes aim to tighten how benefits are used, with a greater focus on approved purchases and program oversight. Supporters say it's all about accountability and encouraging healthier choices out there, while critics argue it could limit access and create new challenges for families already struggling. As we continue our conversation with Feeding Texas' CEO, Cecilia Cole, we're going to break down what this means in practice and who could be most affected moving forward.
How long are you expecting to people to kind of adjust to this before it's kind of in their minds, like, I can't get that item anymore?
Yeah, there's definitely going to be a learning curve. I mean, there are things that have been restricted from, SNAP purchases in the past. People can't use it for, hygiene or toiletries or any kind of alcohol or cigarettes. Even hot foods, prepared foods have always been restricted. So, but it's going to take some time. I mean, people are going to be confused, I think, at first. The retailers are doing a good job with signage. Texas Health and Human Services, which is in charge of the pilot, I think has done a good job. They have a website that people can go to learn about the restrictions. But as always, it takes time to get the word out on these sorts of things. So we do anticipate there'll be questions at the grocery store, confusion as people adjust. It's hard to say how long it will take, or whether some of those concerns about, specific regulations, how big a concern that'll end up being. It's really too soon to say, and we'll be on the lookout for it. Our food banks, we have 20 food banks with operations in every county and lots of great connections to their communities. And so we'll have the opportunity to ask questions and learn if there are challenges people are facing, and then we can lift those up to the state.
Absolutely. You talked about it a tiny bit at the beginning. Reading food labels now, especially with certain items, is very, very vital, depending on what you get. What are the key words and key things? Again, you talked about it a tiny bit, but can you expand on it, the key words people need to be looking for in the back of products that are being limited?
Yeah, so the only products they have to pay close attention to are sweetened beverages. So if they're looking to buy, fruit juice, look to make sure it's got 50% or more fruit or vegetable juice. Anything below that would be prohibited. Look for grams of sugar. So 5 grams or more of sugar is going to be prohibited. So look for words like low sugar or unsweetened on the label. Look out for artificial sweeteners, because anything with artificial sweeteners is also restricted. And then I think when it comes to candy, in the candy aisle, pretty much anything in that aisle is going to be restricted. However, if you're wanting to buy chocolate chips to bake with, that's allowed. But things like candy-coated raisins and any kind of fruit or nuts that is sugar-coated, that's going to be restricted. So again, if you say sweetened beverages, that's obviously a broad category, and so is candy. So it's going to take some time. There's no sort of exhaustive list you could come up with of every product that falls into those two categories, because there's so many products on the market, so many more coming on every day. So I think the challenge is really going to be for retailers, making sure they get it right and they're able to program their systems and that it's consistent across retailers. I think that's also been lifted up as a potential concern. But when you're shopping, again, look for the label. Probably not a bad idea to read labels anyway, but we know they can be confusing. So look for added sugar, look for artificial sweeteners, and stay away from nuts or raisins or fruit that's coated with something sugary.
Yeah, only a couple more questions for you. I appreciate it. Do you think this it's going to take like it's like anything else? It's going to be a learning curve. Do you think it's going to do what it's intended to do over the years ahead here in Texas to make people that maybe aren't used to buying healthier foods start to rely on some healthier foods?
Yeah, I mean, the Texas Health and Human Services is going to be doing an evaluation. So they'll be doing pre-surveys and then surveys throughout. The pilot could go for up to 5 years. The legislature is going to be looking at it during the interim. They may revisit it next session. But I think, people, one thing that will certainly happen is people will pay more attention to what they're purchasing and pay more attention to labels. But whether that alone is enough to reduce consumption when you can still use your own dollars to purchase those items is an open question. But typically, bringing about the kind of, I think, behavioral change that we really want to see goes beyond simply saying, no, you can't buy this, or it goes beyond SNAP restrictions. It requires, evidence-based nutrition education and other types of interventions that really help bring about that kind of long-term behavioral change that I think is what everyone's looking for here.
Yeah, absolutely. Probably my final question here. Is there any concerns that you guys have with these changes now, not in a political way, but just with what might just happen for some residents in Texas? Maybe you got into that a little bit in some of my other questions.
Yeah, I mean, I think what we want to see is consistency in how they're implemented. So consistency across retailers in terms of what gets restricted. I think really good education with SNAP participants to help them adjust. Those are some of the things that we're looking out for. But like I said, if there are unintended consequences, we will be looking to HHSC to identify and sort of adjust to those. We'll also be doing our best to lift up any concerns that we hear from our communities.
And as Cole mentioned, there are other long-standing SNAP restrictions that continue under the updated rules. Benefits are limited to essential grocery items, meaning prepared hot foods like rotisserie chickens are not eligible. Same goes for non-food necessities such as cleaning supplies, paper goods, and personal hygiene items. SNAP also does not cover alcohol, tobacco, or products labeled as vitamins or supplements. While these guidelines are meant to keep the program focused on basic nutrition, Critics argue they can overlook the broader needs of families trying to stretch tight budgets. Supporters, however, say the limits help maintain the program's core mission and accountability. So beyond purchase limits, other SNAP rule changes now in effect. As of February, adults between 55 and 64 without dependents must meet new work or job training requirements to keep their benefits. There are also updated rules for parents. Those with children aged 14 and older may now face similar expectations. Supporters say these changes encourage workforce participation, while critics warn they could put added pressure on older adults and working families already navigating economic challenges. All right, when we come back tonight, we're going to hear from U.S. Agriculture Secretary Brooke Rollins about the federal push for more states to add these restrictions and why the administration thinks it's important for the health of the United States. We'll be right back. Welcome back here tonight. As Texas enforces new SNAP restrictions, similar efforts are gaining momentum nationwide. The USDA, meanwhile, is working with states to shift benefits towards what officials call real food, while limiting purchases like soda and other processed items. In a conversation with News Nation's Katie Polovich, U.S. Agriculture Secretary Brooke Rollins says more states are signing on, but not without some pushback, raising broader questions about how far these changes could go and who they ultimately will impact.
You mentioned the MAHA movement. USDA, of course, is trying to encourage people to buy real food, fruits and vegetables that are farmed by our amazing farmers, and beef, chicken by our ranchers. They want SNAP to be purchases to be real food, correct, removing junk food. But nearly 20 states have sent in waivers. They still want to be able to buy the junk food. So are there more reforms ahead for those waivers, or rejecting them at some point?
So just a quick correction. The 20 states that we have sent in waivers and have approved have actually been to get junk food out of SNAP.
Okay.
Yeah.
Good.
So an important distinction with a big difference. And the reason is this: the SNAP program, which is one of the largest government welfare programs, actually just as of last week, we just got under 40 million. We've just moved 3.5 million people off of government food
And they've been working on fraud as well.
Oh, my fraud and welfare to work and the new blue collar wage boom that is happened under President Trump has resulted in that. But at the very beginning, the way that food stamps work statutorily is that it's a federally funded government program, but the states run it. So every state is different. It's 50 different programs, basically. So when I got here and I looked around and said, why in the world are all 50 states allowing junk food and sodas to be purchased with taxpayer dollars on the front end? And then the back end, the health issues, 3 out of 4 of our kids aren't militarily ready, right? The obesity and chronic disease epidemic is hitting about 60 to 70%, not just of our older Americans, but of our youth. I mean, it's a mind-blowing thought. We're already spending, I think, 60 cents of every taxpayer dollar on health care. Yeah. A lot of these programs, this is unsustainable. So on day one, hour one, I walked in this office, Justice Clarence Thomas swore me in. I sat at that desk, and the very first thing I did was sign a letter to every governor in our country saying, partner with us, stand with us, send me your waivers. You're the laboratories of innovation and democracy. This is not Democrat or Republican. And so we've had a really good year. We've got more waivers coming in, hopefully another dozen or so very soon, but we've already approved 20. So in those 20 states, you cannot use taxpayer-funded food stamps to purchase junk food and soda. The idea is we, of course, get to all 50 before we leave, but we've been sued by a couple of the blue states who apparently want taxpayer dollars to be used to, let kids drink Coca-Cola. I don't understand it, but we're, sometimes it's an irrational world out there.
That is true. Before we go, I want to ask you about this new.
And as part of Washington, D.C.'s push to make America healthy again, U.S. Secretary of Health and Human Services Robert F. Kennedy Jr. visiting the state of Texas, and during a stop here in the Lone Star State, he dropped by an elementary school in Austin to see how changes at the federal level are already changing school nutrition. Namil Ramania has that story again and tells us why protesters also showed up there.
We've come a long way.
Trays of fresh fruit and vegetables.
Our food trays today are not what you see of the food trays of the past.
That's what students in Austin ISD are greeted with when they line up for meals these days.
We've got 3 minutes.
Ryan Mikulicek is the one in charge when it comes to everything nutrition in the district. His goal, keep kids healthy.
We lean into fresh fruits and vegetables. We procure local apples, local lettuce. We have been leaders in farm fresh initiatives. We've been leaders in clean ingredients. We've been leaders of getting dyes out of food.
Y'all want to say hi to him? Say hi.
That work being noticed by Robert F. Kennedy Jr., the United States Secretary of Health and Human Services. He stopped by Cunningham Elementary speak with the lunchroom staff and AISD administrators about the work they're doing. He also took time to serve some food and talk to a few students in the lunchroom. Could we ask what you thought of your visit today?
It's fantastic. It's so great to see these kids getting healthy food, hot food. And this is what we need to do all over the country.
Under his Make America Healthy Again, or MAHA movement, he's taken aim at processed foods, preservatives, food dye, and other chemicals found in our food.
And then getting the food dyes out of the school lunches and, all of the toxic ingredients. We got the sickest population in the world right now. And it's because they're eating bad food. 70% of the calories that kids intake today are ultra-processed foods, and that's just poison.
As RFK Jr. toured inside, a few people rallied outside. Unhappy, Austin ISD allowed him to stop by.
They've been able to say thank you, no thank you to other things, and that, it's just, disruptive to the school day. We think that his interest in nutrition is a little eclipsed by all of the other problems that he brings to the table.
One of the many concerns they had was about his vaccination policies. Some of the people holding signs like this.
As far as vaccination rates in Texas, where do you stand on that? Any concerns?
We encourage people to comply with the vaccine schedule.
While he didn't elaborate on vaccines, he did say he was impressed with what Austin ISD is doing when it comes to feeding kids.
This project is really a pilot for what we should be doing across the country.
All right, that was Nabel Romani again reporting for us. As we've also learned tonight, Texas is restricting what SNAP recipients can buy, banning sodas and candy. But some health experts and patients say the change could put lives at risk. Many Texans with diabetes rely on sugary drinks during sudden drops in blood pressure. And again, under these new rules, SNAP benefits can't be used for quick fixes. As we've heard, state and federal leaders say the goal is to reduce unhealthy food purchases and improve long-term health. But critics argue it creates an uneven playing field where low-income Texans may not have fast, affordable access to the sugar they sometimes urgently need. Doctors say alternatives like juice and glucose tablets can work, but not everybody agrees they're as accessible or as fast. With more than 3.5 million Texans on SNAP, the state is now studying how these changes will impact health and behavior. All right, after this quick break tonight, closing words on your topic. We'll be right back. Welcome back here tonight. As we close out tonight, we've looked at the new SNAP restrictions now in effect across Texas, from limits on what can be purchased to new work and eligibility rules shaping who qualifies and how benefits are used. Again, supporters say these changes are about accountability and encouraging healthier choices. Critics also warn they could create new barriers for families already facing tough economic realities. What's clear is this, for millions of Texans, SNAP is more than just a policy. It's certainly a lifeline. And as these changes take hold, the real impact will be measured not just in budgets or guidelines, but in kitchens and communities across our state. That's it for tonight. Next week, of course, we're going to zero in on much more issues across East Texas. That's all happening this coming Saturday right here on East Texas in Focus. Have a great rest of your night, everybody.